Anybody can suffer from mental illness. I'm very grateful that I haven't, but Paul Merton has. He, during a period in the 1990s, went through a spell of feeling paranoid. He thought the builders in the building opposite were spying on him. He occasionally had really violent feelings that he could strangle the people around him and not stop himself from doing it. And he just generally felt thoroughly queer and difficult feelings to cope with, and very frightening. So he checked himself into the Maudsley Hospital for investigation. And after a while, it was discovered that the reason why he was having these episodes was because he was on an anti-malarial pill. He'd been on holiday with his then girlfriend, to Kenya, and so had been taking anti-malaria pills, one which was daily, which was fine, but also a weekly one, which was the one that was causing the problem. And as soon as they realised that this was what was making him have these paranoid and violent feelings, and he stopped taking them, he stopped having the feelings. And so, although he experienced what being mentally ill was like, the fact that there was an easy diagnosis and cure made it slightly different from other illnesses of the same kind. But while he was in the Maudsley, he was appearing in a television programme at the same time. In the breakfast queue one morning, a young man who he later discovered was called John came up to him and said, aren't you Paul Merton?" Obviously confused because he was both on television and in the hospital. But he'd recognised him, and Paul apparently asked him to keep it quiet. Some years later, Paul Merton went and did a book signing at a shop fairly near the Maudsley, and a nurse came for a signing and said that she wanted to tell Paul about John, because she said she'd had this patient who had had a conversation with Paul in the breakfast queue. Did Paul remember it? "Oh yes," said Paul, "very well." "Well," said the nurse, "he began to get very much better after that conversation, because he had discovered that it was nothing shameful about being mentally ill, that if people who could appear on television could also be in the Maudsley, then he had no reason to be ashamed of the fact that he was there too." Paul Merton goes on, when he's describing this, to say how important it is that we all realise that mental illness is something that could happen to anybody. And this is Mental Health Awareness Week. And I thought it was just remembering how important it is to see mental illness on a par with all other illnesses, in the sense that it is nothing to be shameful about, and something which can hit any one of us at any time. And we need to be very grateful for the ways in which the medical people are beginning to learn how to cope with some of these illnesses and provide the medication that will help people to survive though their condition continues, but also to reach out and be encouraging to all those who, at whatever level of illness they are experiencing it, have mental health problems.